Congratulations on your new beautiful baby girl, Miss Sanchez. I'm going to go over some discharge teaching with you to make your transition a little bit easier at home. The first thing we're going to discuss is diet. Adequate nutrition is good for your body to heal. Whew, it is. You should eat foods high in fiber, which include broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which include dark green leafy vegetables, milk, and yogurt. Drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. Activity. Gradually increase your daily activities until you are back to your normal routine. Rest frequently. No lifting, pushing, or pulling for the first 2 to 6 weeks, or as instructed by your physician. Do not drive until you are released by your physician. Whew. Breast care. Your breasts, are you breastfeeding? Yes or no?
Yes.
Okay, so this will pertain to you. Your breasts and nipples may have changed or have grown in size during your pregnancy. Wearing a well-fitted supportive bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking, and leaking may occur for several weeks to months. You may apply ice packs between feedings to ease discomfort. This is if you were not going to breastfeed. Wear a well-fitted supportive bra for at least 3 to 4 days following delivery. Refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement. Apply cold compresses in the form of a frozen wet towel, cold packs, or ice packs for 15 minutes at a time, every hour as needed to prevent tissue injury. Do not apply cold directly to the bare skin. Do not massage or apply heat to the breasts. I'm going to give you some breastfeeding tips. Your baby's mouth should form a tight seal. The lips should be against the areola, not the nipple. If the baby is suckling incorrectly, slide a finger between your baby's lips and your breast to break the suction gently. Reposition and try again. How long should you nurse? As long as your baby wants, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, though not for very long. It is important for the health of your breasts to have your infant feed from both breasts every feeding. Good signs of nursing: hearing your baby swallow without a clicking sound, seeing movement above the baby's ears, the ears may even wiggle, and not seeing dimples in your baby's cheek. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it may mean the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. Do not get stressed out. Hygiene. Wash your hands frequently as you are caring for yourself to prevent infection. Always wipe from front to back after going to the toilet, and clean your bottom with warm tap water using that Perry bottle that we gave you. After you urinate or have a bowel movement, it is important you change your pad frequently. You want to stay dry. Bleeding. Vaginal flow will decrease in an amount from bright red to pinkish or brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. Bowel movements. Avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to your normal pattern. Increase fluid and fiber in your diet. Birth control. Discuss birth control options with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse. Sexual activity. Nothing should go into the vagina the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman feels physically and emotionally ready. Warning signs to report to your healthcare provider immediately. So let's pay attention to these. redness, warmth, swelling, drainage, or foul-smelling discharge from the incision or the incision begins to open. Perineal laceration or C-section incision. Discharge from the vagina that has a bad odor. Severe headache or blurred vision or visual changes. Temperature over 100.4 or you feel cold, feverish, and have chills. Thoughts of harming yourself or your baby. Please don't hesitate to reach out and call someone. Pain or burning sensation, redness, warmth, or swelling in the legs. Breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms. Sharp pain in the abdomen, breast, or chest. Trouble breathing, dizziness or faintness. Crying spells or mood swings that feel out of control. Unable to empty your bladder or urination that is painful, difficulty, or too frequent. Difficulty having a bowel movement. And then, of course, if you don't feel safe at home, report domestic violence or abuse. Call 1-800-96-ABUSE. Now for your beautiful baby girl, we're moving on to her. Safety, sleeping. Place your infant on her back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parents, but not in the same bed. Avoid covering the infant's head or overheating. A bulb syringe. Keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe well with warm soapy water after each use and allow to air dry. Wash your hands prior to handling the neonate. Car seats. All infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. The use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new infant at home. Question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS. Now, behavior. Crying, it's a normal response for your infant to cry. The most likely cause for crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feeding. Calming techniques include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend. Please call a friend if you feel any of that. Don't take this upon yourself. Sleep patterns. Infants require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding. You should place your baby on his or her tummy each day for supervised tummy time. It's their little exercise time. Tummy time. This will strengthen his or her neck and abdomen. The diet, you're breastfeeding, so your infant should breastfeed 8 times a day per infant cues. Positioning, be sure to hold your infant close to you while you're feeding. Your infant needs to be cuddled or skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing her back to burp. Formula feeding. your neonate is receiving a Similac or Enfamil diet. If your baby sleeps longer than 4 or 5 hours and misses a feeding, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. Positioning, be sure to hold your infant close to you while feeding. Your infant needs to be cuddled. Never prop your infant's bottle to feed. Burping, infants need to be burped every ½ ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing her back to burp. Now, some newborn characteristics. Newborn rash. It is normal for your infant to develop a rash on his or her skin. It appears with a small red circular areas with white dot in the middle. This does not require treatment and will generally resolve within the first week of life. Avoid lotions, powders, and perfumed soaps. Milia are pearly white bumps, usually on the face, especially on the nose, and they will disappear within the first week of life. Jaundice is a common occurrence in newborns. Your infant may appear to have a yellow coloring to his or her skin. It will start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours, you need to call your healthcare provider immediately. Bathing. Your infant will need to be sponge bathed until the umbilical cord falls off. Use a soft washcloth and plain water. Gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant type soap may be used on your infant's body. Cord care. Keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will gently fall off within 2 weeks of life. That's pretty cool. Wet and dirty diapers. 1 to 2 wet diapers are normal for the first day or 2 of life. Then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. Let's talk about her genitalia. Always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. It is normal for baby girls to have a white or pinkish discharge. The secretions are normal and will gradually disappear. If you had a boy and he was uncircumcised, you're always going to wipe the baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. For if you were going to have them circumcised, always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. Vaseline gauze is applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially and will change to have a yellowish sticky film. This is very normal. If you see any bright red bleeding or green dish drainage, you should contact the healthcare provider. The plastic ring method of circumcision does not require a dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green drainage, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad in plain water. Dressing. Dress your infant as you would yourself. Avoid overdressing your infant. Too much clothing and too many blankets may cause your baby to become overheated. And vaccines. Infants should receive all recommended vaccinations. Ms. Sanchez, I know I have gone over a lot of information with you and it could be overwhelming. I've printed out a packet for you to take home. If you have any questions, please do not hesitate to reach out. And again, if you're feeling sad or blue, you got the baby blues, please don't hesitate to reach out. If not back here, to a friend, to your mom, a parent, your spouse. But any questions?
I'm good, thank you.
Well, congratulations again on your baby.
You.